Shin splints, or medial tibial stress syndrome, is characterized by a dull, aching pain and tenderness along the inside of the lower leg. I used to have a lot of difficulties with shin splints whenever I would get my mileage over about 40 miles per week, but I haven't had any problem with them in years. Let's talk about how to fix shin splints. Medial tibial stress syndrome accounts for about 30% of running-related injuries, and is thought to be caused by either a tensioning of the fascia on the outer lining of the bone or a failure during the bone remodeling process. The most preventable risk factor for developing shin splints is a rapid increase in running mileage or intensity. I'll post a link to my video on training errors, give you a little bit more guidance on that. The most common issue I see in running mechanics is excessive pronation. That can happen for a myriad of different reasons, and your physical therapist can help you figure out what things you need to address. But today I'll just give you a few different ideas. If joint mobility is an issue for you, we're going to work on kneeling down onto a pad. We're going to place a dowel rod by the big toe, and we're going to lean forward as far as we can without letting the heel lift up off the ground. We're going to work on moving that ankle into good dorsiflexion range of motion. We're just going to repeat this back and forth about 30 times. If calf tightness is an issue, we're going to put the balls of the feet up on a 2x4. We're going to lean into the wall and get a stretch of the calf. We want to do this with the knees straight and with the knees bent. We're going to hold the position about 30 seconds and repeat 3 times. Improving strength of the tibialis anterior in the front of the shin may help to balance forces across the tibia, as well as help to limit excessive plantar flexion, which is another risk factor for shin splints. So we're going to stand with our heels up on a slant board, and we're going to lift the ball of the foot up and down to help strengthen the front of the shin. We're going to do this 3 sets of 10 to 20 repetitions. Improving strength of the stabilizing muscles of the foot and ankle may also help us to limit excessive pronation. In this case, we're going to stand on one foot. We're going to anchor a band in the door jamb. We're going to hold the band out and we're going to twist our body away from the door. I really want to give special emphasis to controlling on my way back. And we're going to repeat this for 3 sets of 10 to 20. During the acute phase of the injury, an over-the-counter orthotic or switching from a neutral shoe to a stability shoe might help to limit some of that excessive pronation and allow us to heal a little more quickly. Also, during the acute phase, it's really important that we give the body rest. Now, this doesn't mean no running, but if I continue at the volume that hurt me, I'm going to have a hard time getting better. So just think relative rest. Early on, if I can reduce my volume by 25 to 50%, that might be enough to allow that injury to heal up more quickly. We can certainly include some cross-training during this phase. I can progress back to my normal training routine once I can get through all my daily activities without pain, and I no longer have tenderness on the inside of the shin. So just progress back gradually. Well, that's all I've got for today. I hope that some of these ideas will help you get through your shin splints and get back out on the road and running.